So, hey, welcome back, everybody. Today we're going to talk a little bit about lower back pain. This is my good helper, Kaylee. Sorry for that, scared you there. Lots of different causes for lower back pain. Of course, it could be due to some sort of a disease process, or it could be accident, or it could be some kind of a chronic problem. But I kind of wanted just to break it down into a few basic categories for you so you can understand what's going on. I've got my little helper here. This is just a plastic model of the spine. Your spine, it's got 24 movable vertebrae here, and they should be aligned in a fashion that's fairly straight up and down. The vertebrae are erected like a pillar so that the spinal cord can go right down through the middle of the spine unimpeded or without any kind of restriction or pressure on it. Some causes of lower back pain can include when there's a deviation of that spine like this. And that spine can be curved or crooked in there, and it can put a lot of undue stress and strain on the spine. Okay, a condition of this much would be actually called a scoliosis, but it doesn't have to be that much. It could be that just one or more of the vertebrae are actually tilted over or not in an optimal place, putting pressure on the nerve. That's one of the causes of lower back pain. Another thing that can happen is if you look at the spine from the side view, you notice how it's curved. That's really a good thing. It's supposed to be that way. There's supposed to be a normal arc there in the lower back, and that's your body's ability to absorb shock like a spring or a shock absorber would be. But you know, if you take that situation and you make it too much, we call that a condition of hyperlordosis. It just means there's too much curve in there. It can actually start to jam the lower back together. And we see this a lot in women who like to wear high heel shoes, because when they wear those high heels, it actually jams those parts of the bones in the back together, and it can cause a real dull ache right across the lower part of the back. Now, a more serious problem that we can have with lower back problems is what we call a herniated disc, or a disc that's bulging. Almost everybody has probably heard of somebody who's had this condition and resulted in having lower back surgery. And these little discs are the little spacers here in between the vertebra. And oftentimes, if a vertebra is misaligned, like what we talked about before, even though there's not a lot of pain, if the person is walking around on that daily, it can start to wear that disc out and get little micro tears in the disc. And then eventually, the guy just bends over one day to pick up a pencil and the disc bulges. And when that happens, it actually bulges back and it hits against that delicate little nerve there. And that person now is experiencing a considerable amount of pain. So oftentimes that pain can radiate down into the rear end or all the way down into the legs, and that's called sciatica. A disc problem like this is much more severe than just a pulled muscle or a strained ligament. Oftentimes, if not corrected properly, this can actually lead to surgery. So today we're going to just look at Kaylee's lower back and show you a few techniques that we can use to give her some relief. Okay, so I'm going to demonstrate just a real basic little test. It's actually called Kemp's test. This is a standard orthopedic test that we can use to discern if the person has got some kind of damage to the lower structures or the bones of the lower spine here. Okay, so Kaylee, I'm just going to gently turn you and lean you back, just like that. Is there any discomfort there when we do that? Okay, so that's causing her some discomfort. And normally, just this motion like that really won't hurt. But if there's some damage to those structures there, it'll elicit pain. It can tell the doctor a little bit more about what we need to do. Let's check the other side. Can you turn around?
Yeah.
There we go. And we'll just do the same thing here. Excellent. Any discomfort there?
Yeah, there is.
Okay, so she's having discomfort on both sides there. Are you having any pain that's coming down into your legs?
No, not really. It's just centered pretty much like right here, right in my lower back.
Okay,
So.
got it. So if Kaylee was having pain that was radiating down into the legs, we might consider that she may have a nerve that's being pinched in there. But in this case, it may be just the actual structures of the lower back are kind of jammed in there. And we'll also do some palpation, which is of the muscles, to make sure that it's not just a muscular problem there as well.
Okay.
So why don't you go ahead and lay face down on the table for me and let's take a look.
Okey-dokey.
All right, so we've got Kaylee down here on the table. We're just gonna, this is what we call palpation. It's actually just a fancy word for feeling around of the back area here. But when I press right in here, Kaylee, is there any tenderness there?
Yes.
So she's got tenderness directly over the spine, which more than likely would indicate that the vertebrae themselves are involved. We can come out here onto the belly of these muscles that run up and down along the spine. Are these tender or no?
It's a little bit when you go a little further up, but more so on the bone.
Okay. And how about over on this side?
That's
Not so much. So these muscles are a little bit more taut on this side than they are on this side. She's got a little bit of tenderness in here, but my suspicion is that most of her problems are really located right over the spine. So if these vertebrae stop functioning properly and they don't move and glide quite as well as they should, either due to, like we talked about, wearing high heels or just due to some kind of an injury, and I know from talking with Kaylee in the past, she's been in several automobile accidents, that it can cause these vertebrae to lock up, and that causes them to kind of swell and become inflamed and cause chronic problems, which can actually lead to arthritis forming in the joints themselves. So by moving these vertebrae and getting them functioning again, it can actually help to reduce some of that swelling that's in there and actually make her back last a lot longer time. And in this case, what we're going to do is go ahead and adjust her. And if you'll, Kaylee, if you'll roll up onto your side for me.
Okay.
And give yourself kind of a big hug just like that for me. And we're going to get right on that vertebra and just gently move it. Let your lower back relax there. There we go.
Okay.
How'd that feel?
Better.
It feels good. All right. Very good.
Okay.
Excellent. So we've made the adjustment on her one side. Now I've had her roll over. We're going to do the other side. Just relax right here for me. Good. Very good. The adjustment's very gentle, and it doesn't really need to be hard, but it's very effective in getting the mobility restored in the spine, which is going to make her feel a whole lot better.
Yes.
Okay? Absolutely. So the other problem that we talked about was a disc problem in the lower back. Those discs are the little spacers that lie in between the bones, and oftentimes they can bulge, or the common term is a slip disc, and it can put pressure on the nerves down here. So I just kind of wanted to briefly show you how we go about taking care of that conservatively without surgery or drugs or medication. We just get right on the vertebra, and this table flexes here in the middle. And as we traction this, it helps to pull that disc back into the right place. And it also feels very good.
Yes, it does.
Yes, it does. And this really helps to push fluid back into the disc and get it more into the right position. Using this technique, we've actually helped to keep people from going to have surgery, or if they had to have surgery, we rehabilitated their back with this technique so they didn't have to go on to have another surgery in the future. All right, very good. Okay, so we finished her adjustment on her lower back. Kaylee, how are you feeling now? Are you feeling?
There's definitely been a release of pressure in my lower back, so it feels really good.
Excellent. Well, hopefully this has given you just a little bit of information about just some general things that can happen to lower backs. Of course, there's a lot of different things that can happen and reasons that it happens, but these are very safe and gentle techniques to help restore a spine to normal function. Hope this has been some help, and I will see you next time.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psyche Truth channel.